Hello and welcome everyone. Once again, this is Dr. Steve at Chiropractic First here at Thompson Plaza. Again, I just want to tell everyone hello and hope everybody's staying safe and healthy during this season, this pandemic. Today, we're going to be covering part 3 of our series of 5. If you haven't seen the part 1 and part 2, please make sure you go back and watch those. I think we have a link now on YouTube on our Facebook page. Also, you can contact the office. Most of you should be receiving these via WhatsApp or email. And of course, if you have any questions, please feel free to send those in. At the end of each session, I'm going to try to answer a few questions that have been sent in, so we'll get to that. So if you send them in, we'll try to answer them here for everybody. So I'm sure if you're asking a question, everybody, there's more people that have that same question. So today, again, we're on the critical health series. As you recall, it's what we call our critical health. These are our vital signs. All of these are going to be a different series and a different part. First one was on the central nervous system, so if you haven't had a chance to see that, please go back and watch that. We talk a lot more about the nerves and how critical they are to our health and how we need to maintain. If you want to have optimal health, you really need to have a healthy nervous system. The rest of these are all supplements to that. Last week, it should be coming out to you shortly. It's on nutrition. What supplements, what kind of diet we should be eating, and more importantly, why we should be eating correctly and what we need to be avoiding to have optimal health. Now today we're going to be talking about our bad habits and our posture and how this actually affects our health. And of course next week we'll be talking about some of our rest, recovery, and sleep, and then of course exercise at the very end. So as we go into this today, I just wanted to make sure that we understand these are the questions we're going to be answering about our posture. First of all, what is posture? What's good posture? What is bad posture? What are the differences? What effect does that have on your health? If you have poor posture, how do I check my posture? And of course, if you have poor posture, how do we correct that? So this is what we're going to be focusing on today. This is really a popular subject with parents who have children who play a lot of games, or they're working on their laptops or playing on their phones. Posture and slouching, these types of things become very important and very critical. And I want to talk a little bit about, not just how it appears when you have poor posture in your appearance, but as far as their health and their function of their body and their minds and brains, how everything can be affected by that. So the first thing we need to understand is what a good posture or a normal posture is. So I'm going to show you some anatomical drawings and then pictures of these, and then we'll go through what they actually look like on x-rays and then in real life. So first of all, when we talk about posture, we're talking about our spine. Okay, the spine is, looking at it either from the back or from the front, should be straight. We shouldn't have bends and twists. As you see over here, here's a normal spine. As you can see, the hips come straight up to the shoulders. Over here we see an abnormal posture, which is sometimes referred to as scoliosis if it gets to a certain degree of curvature. Obviously you can see the misalignment there. A normal spine from the side, you should have curves. This is called a lumbar lordosis, a thoracic kyphosis, and then a cervical lordosis. So the head should be above the shoulder above the hip, and the hip above the ankle. So we can see, sometimes you see people, it's quite common right now, seeing a lot of people with what we call a kyphosis or a kyphotic posture, where we get a rounding in the spine. So those are abnormal. So just so you can start to get an idea as to what proper posture actually looks like. So on an x-ray, this is what they look like. This right here is an accentuated curvature. This is actually a normal curve. So this is the back of the head, and the person is standing with the arms folded in front. You can see the neck curves this way. We have that lumbar lordosis. This one is actually a little bit accentuated. This is actually before and after some treatment, and we can see how the spine and the posture actually has begun to change. When we look at somebody from the back, okay, you can see on this one here, these are the shoulders. Okay, you can see the collarbones here. These are the lung fields, the black here. And you can see, instead of having a straight line, a straight spine, it's actually bent to the side. This is what it should look like. It should be straight like this. Okay, looking at the neck, and some of you have seen this, if we go through the degeneration phases, this is actually a normal neck. This person's facing this way, obviously. You can see the jaw and the teeth. But we should have this nice cervical lordosis, or curve in our spine. This is really critical. We're going to talk about here in a few minutes because of the weight of the head, okay, and the length of the spinal cord, which we'll also talk about. So in a phase 1 degeneration, what happens is we lose that normal curvature. So the spine starts to become very straight, very vertical. If it stays there for very long, those discs will literally start to collapse. Those are when we get into the degenerative phases. This tells us how long a poor posture has actually been there. So the phase 2 or the phase 3, we actually start to see degeneration. We start to see bone spurs. Some people, they go to the doctor and they say you have osteoarthritis, spondylosis or spondylophytes. You start to see those on that degenerative phase, and then of course if it stays there longer, so this first phase can take up to about 7 to 10 years. Getting to the next phase of degeneration would be about 15 to 20 years, and of course when we start getting beyond 20 years, we start seeing a lot of collapse. We'll talk about those again here in a little bit. So those are what an x-ray actually shows. So the question is then, how does our posture actually affect our health? What does that have to do with anything? And just like when we talked about nutrition, if we can understand why our posture is important, it helps us focus on what our posture is. Now I apologize, I'm speaking really, really fast. I'm going to go through these. I'm trying to keep these as short and condensed as we can. Hopefully you can re-watch them over and over again if you need to. But I really want to be able to get this critical information out, so I'm kind of moving quickly. But there's actually a research that's actually done in the United States, and this is called the arcs of life. And they found that if you have an increased humping or an arc or curvature, that kyphosis that we talked about in the spine, okay, it's called a hyperkyphosis, which means it's too much. And if you have that, it can actually decrease our lifespan up to 15 years. Now some of you have heard me refer to this before, and so there's a reason why when you see people in this position, they weren't born that way. These are posture habits that have developed into this, but it definitely does have an effect on your lifespan. So one of the reasons it does that is because if this is a normal neck and the spinal cord sits inside this, in that normal curve, anytime the head goes forward, if you're looking down or if you are in a structural kyphosis, this is a normal curve, and you can see how accentuated this one is. What happens internally is like a rubber band. When you have a rubber band that's relaxed, it's nice and thick and relaxed. When you actually stretch it, you can see that same rubber band becomes very tethered and very thin, puts a lot of tensile stretch and strain on that nervous system, or on that elastic. So the same is true with our spinal cord. So when we have a normal posture, as again, you can see the ear is over the shoulder is over the hip is over the ankle, everything is in a proper posture. There's no tension on the spinal column or the spinal cord. When we have a slouch or an increased kyphosis, which we see a lot, in this position, we start to get now a tethering or a stretching on the spinal cord inside. That's one of the things that changes the function of our organs, your heart function, your respiratory, your adrenal glands, all of your different hormones function, digestion. Anytime you put tension on the spinal cord, it will affect our internal function of our body and ultimately our health and longevity. So there's actually research done in Spine Journal back in 2005, and this was very interesting because it was a big study. There were 752 subjects, and what they wanted to do was actually test people that had no symptoms. So you can see on here they didn't have any digestive, they didn't have any headaches, they didn't have any type of condition as far as what they could feel. And so what they found was that anybody that had even a slight head forward tilt or that rounding, that kyphosis, they started to notice they started to have breathing difficulties or changes in their breathing pattern, their heart rate, digestive, their thyroid function, kidney functions. So the conclusion of this research, and this is just a very short synopsis of that, at the conclusion they basically said that everyone should get their spine checked for subluxations. Now we talked about that in our previous courses. That's when the spine is not in its normal posture, when it's slouched, if it's misaligned or not functioning, it's called a subluxation. They found that everybody should be checked for those, even if they have no symptoms. So again, here's a normal posture, a slouching, and then that real severe kyphosis. So it just goes to show that even medically in the research has been showing that this has been going on. The question is, how does this happen? So how can we avoid that? Another research done by a medical doctor, Dr. Sperry, they actually found that 90% of the nutrition and the function stimulation to the brain actually comes from movement of your spine. So we have 24 different segments in our spine, and if any of those are fixated or not functioning, it decreases oxygen, stimulation, and nutrition to our brain, which then causes a reaction difference. So we can't function, the brain can't function or respond as it normally should. So again, over time, this is going to lead to health. The severity of the blockage or the number of dysfunctional segments in your spine will increase the symptoms and the disease that we're going to have. So again, this is all from medical research. So basically what's happening is every one of these segments, as they move, these spinal joints move, that nerve energy goes up to the brain and it allows reaction going back and forth, which keeps us in what we call homeostasis, or in a normal pattern. So we talked about this. The central nervous system is the master system. This is why our posture is so very important. This is why it's so important that we get checked and adjusted frequently and consistently. Because if you interfere with any of the nerves anywhere along that spinal area, it's going to change some of the cells, tissues, and organs in your body, even if you don't feel it. So, a normal spine, again, this is an x-ray. You can see the curve. This person is facing this way. This is what, on an MRI, this is what they actually look like. The spinal canal is wide and open. The disc spaces look good. If we have a reverse of that curve, or a subluxation, or a bad posture, it starts to compress the cord. Okay, so we can see the difference between a normal spine and a subluxated spine, both on x-ray and on MRI. And what they found, they actually did brain scans, and they actually found that a subluxation decreases the oxygen supply to the brain. And so when they actually looked at these red areas on here, you can see that the brain is nicely oxygenated. People, when they had subluxations anywhere throughout their spine, but especially in the neck, but anywhere throughout their spine, it actually decreases the amount of oxygen going to the brain. So this is really critical, not only for your organ function, but think about your learning, especially for kids. They're learning, they're trying to memorize, attention deficit disorders, different types of allergy reactions, digestive problems, stress, anxiety. The central nervous system plays a big part of that, and one of the reasons is because the lack of oxygen going to the brain and the glucose going to the brain. So again, this was back in 2012, medical research that actually showed that this is what's going on. So again, as we look at the different types of postures, okay, we're supposed to have this normal posture here, and you can see in that drawing, you can see here's a normal posture, and over time, once that starts, that kyphosis, it just starts to increase, and we see this quite a lot. When you walk around the malls or anywhere out on the streets anymore today, you can actually see people who have these different postures. Okay, here's a normal x-ray again. This is obviously a reverse cervical, and you can see those discs are collapsing. There's a lot of osteoarthritis in there, spondylophytes. So this is what we want to avoid. And if you have those, it's critical that you get them checked and get them adjusted so that they start moving. Otherwise, they are going to continue to get worse. This is a good posture. Ear over the shoulder, shoulder over the hip, hip over the ankle, and the pelvic tilt is where it's supposed to be. Now some of these you'll see what we call a relaxed or a faulty posture is that pelvis tips forward, and when it does, it creates a compensation where the body's trying to stand them up, which creates some wear and tear and some abnormalities in the posture here. We can see we have a kyphosis where the body's now rounding forward. You can see what we call a sway back. This one is called a flat back. In the US, they actually call it a military neck. It's really, really straight. There's not enough curve, which puts a lot of stress on our discs. And then, of course, we have the rounded back posture. Okay, these are just to give you some examples. So when you look at them in real life, in real individuals, these are, even children can have developed these from a very, very young age. A lot of times you'll hear of scoliosis, and they call it idiopathic, which means they don't know what caused it. There's no genetic reason for it, which, genetic congenital scoliosis is extremely rare, less than 7% of the time. 92 to 93% of the time they are idiopathic, meaning something happened after the child was born and all of a sudden they start growing crooked. And so when we see how the body is compensating, that's what scoliosis is a compensation disease. something in the pelvis or lower spine is misaligned, and the body now will start to compensate to try to keep the eyes level. And we can see how it starts one way, compensates, and then it compensates back. And again, we can see those slouching postures here. A lot of times when you look at people, when we do our general posture evaluations, when people come in, we start looking at the heights of their shoulder, and you can see one shoulder oftentimes is significantly higher or lower than the other one. Now, many times people will come in and they've been partners or a family member, they've been around for years and years and don't even recognize it until we point it out. So this is something you can do with your children, with your spouse, with friends. Just have them stand in a normal posture and look at their shoulders, and if they have one that's higher or lower, you know immediately something's going on in their posture, which in effect is changing their central nervous system. And whether they're having conditions now or whether they're going to have them in the future can be related to the posture. So here's this kyphosis on a full spine x-ray. This person is standing with the arms facing this way, so the stomach and the face is over here. You can see this accentuation of this curve. These are some examples of scoliosis. This one was an 8-degree scoliosis, so it's in the beginning stage. 36 degrees, 39 degrees, and 42 degrees. Now, any of you who have been to orthopedics or have children, or even yourself, adults, anybody that's had scoliosis measured, a lot of times they will wait until they're at 45 degrees and then they'll want to do surgery where they put Harrington rods in the spine, or they'll do hard bracing, which you wear for 23 hours a day. But we know that if we adjust those spinal joints and teach the proper exercises and fulcrum stretches, which we will show later in one of our future segments, we can stop this from progressing and oftentimes even get them to start to correct. So it's very, very important. This is going to definitely have an effect on the central nervous system and the function of the brain. This is what they look like when you go out, and we wonder if we have these in our world today, and we see this so often that we start to think it's normal. But if you notice on every one of these, if you notice the head position, the head is in front of the shoulders, and you can see that slouching or that rounding of the upper back. Okay, so we can see how this is such a big problem. Now remember, the research showed that when you have this, if it stays there, that can shorten a life up to 15 years. So this can really create a lot of problems. Digestive, reflux issues, anxiety issues. You think of any condition, it's going to be related to a central nervous system. Okay, so we see this all the time. You've probably seen people walking around. Now the thing I want to point out is these women here were not born like that. These develop over time. And sometimes when you see people that bent and it's more in elderly, it's just because it's been collapsing and collapsing and collapsing over a longer period of time. But we do see some younger adults that are like this as well. So what we want to do is try to prevent that. That didn't just occur on its own. I mean, it's just something that they weren't aware of or how to correct it. And so we want to keep from that happening. Okay, so here again is a 17-year-old boy. Now what's already occurring, I just want to draw your attention, this area here looks pretty good, nice curve, but the neck, instead of having a 30-degree lordosis in the neck, you can see that that neck is actually curving forward. It's actually a reverse curve. This happens a lot because of posture when we're looking down, sleeping on big pillows that push the head forward. These are creating a reverse in that curvature. It's definitely going to have an effect on the nervous system. Anxieties, depression, memory issues. This is a 16-year-old girl. Now when you look at this one, you see her neck is quite straight. It's not reverse curved, but it is quite straight. But look at this accentuation kyphosis in the middle of her back. She's really, if this is not addressed quickly, she's going to end up looking like that older woman who's bent over at some point. This is at 16 years old. This is a 7-year-old boy. Okay, now the reason I pointed this out is because the shoulder is here. That head should be back here, but you can see it has a curve, and then instead of continuing on from these upper segments, it goes really straight. So already by 7 years old, the head is coming forward and it's starting to go really straight. So this happens at very young age. This is one of the reasons why we love to check children. We can check their shoulders. They're always falling down. They're playing sports. They're playing on their phones. And that's what I want to show you. How does this occur? How do we develop these types of problems? And here's some examples right here. So you can see how sitting, and what's really interesting with children and even adults, We can be in this position for hours and hours, and what's even worse is we do it day after day after day. It's these repetitive postures. Look at the head posture, look at the upper slouching, and we see this continually, and I'm sure you've seen it, and you might even be guilty of some of this. So I want you to see what this looks like. These are some of the things that are causing our problem. Look at the rounding in this little boy's back, focused on that phone. Even adults, we sit on the floor, the back now rounds and the head comes forward. That's one of the difficulties of a laptop, because a laptop, instead of being able to put the screen in front of you, it is down below you, so the head now looks down, and this is what's happening. Now, it doesn't look like it's that bad, and she might get up and think no problem, but if she's like that for 2 or 3 hours, but if she does that day after day, and sometimes people do it even longer than 2 or 3 hours. So we need to be aware of how we're sitting, what we're doing. Okay? So again, here's that normal curve. This is what it looks like when we sit. Okay, so a normal curve, sitting posture. And we can see how that back rounds. It's creating a lot of stress and tension on the spine. Some of you may have heard of the sitting disease, or sitting is the new smoking. And there are a couple reasons that they put this on here. Number one, sitting is the new smoking. What that refers to is many years back in the 70s and 80s, the American Cancer Institute in the US came out with studies on smoking, and they found that for every single cigarette that you smoke can shorten your lifespan up to 7 minutes. Well, in 2005, an Australian research group found that when you sit for more than 4 to 6 hours a day, you sit more than that, it can shorten your life up to 30 minutes. And so they asked, and one of them made a comment, well, sitting is worse than smoking, and so now the term sitting is the new smoking. It's actually worse for you on your overall system than smoking, and there's a couple reasons for that. One is that rounding and the head forward posture compresses the spinal joints and it stretches the spinal cord, which changes organ function. The other portion of that is because the hip is bent, and for a long period of time it crimps the femoral arteries, and it can decrease 1/3 of the circulation of the body. So as a result of that, we tell people, if you have a sitting job, whether you're at home or whether you are at work, you need to change positions frequently. There was a research actually done, and they found that people who sit, they recommended changing at first. It was an hour, anywhere from 60 to 90 minutes. If you're sitting, you need to stand up, stretch a little bit, move around. Then they actually did a second follow-up research, and they said it's actually 20 minutes. Well, the part of the research continued on and thought, well, if you sit every single day, but what if I exercise every day? If I exercise an hour or two every single day, will that counter the effects of this sitting? And they found that it does not. Even if you're exercising regularly and consistently every single day, it will not reverse the adverse effects of sitting. So we need to make sure that our sitting sessions are 1 hour to an hour and a half. Set an alarm on your phone, on your watch. But when that goes off, if you've been sitting, you need to stand up, do some stretches. In our last episode, we'll be talking about stretches. We'll be talking about different exercises that you can do while you're at work, some of them in a gym or at home. But the point is, you need to change positions, because we're finding more people have degenerative discs. This is an actual MRI of the spine, and you can see the degeneration, see the discoloration of the disc. Instead of being hydrated and gray, you can see how they're all black. This is dehydration. You can see the disc material is protruding. Here's another one over here. You can see this spondylitis. There's a lot of inflammation. That disc is almost completely gone in that area. A lot of inflammation. So people who sit have worse disc problems than people who are up moving around, and even in physical sports like American football, rugby. We thought they would have worse discs than people who sit, and it's just the opposite, because sitting is a disease. It literally degenerates us. We're not made to sit, and yet that's what we do because of technology these days. So this is important for you to see, because some people, some of you have been told you have slip disc or protruding disc. The disc doesn't actually slip, it just expands and protrudes, and it bulges, and it looks like it's slipping, so they call it a slip disc. And so this is really important. This is what's happening if you have those, and if you don't have those, this is what's going to happen. So we need to make sure that we change our posture. So how does this happen? When you start looking at everyday people and the way they work, you can start to see different postures that are going to create problems. Again, sitting at a computer, look how rounded his back is. It's a natural tendency to want to lean toward that computer. Okay, we've got a rounding up here looking at the phone. A lot of times we'll see women sit with one foot underneath, but if you look at the tip of her pelvis, and they may sit like that for several hours, and it might be day after day after day. I did some ergonomic studies in the US for IBM, and when we did, we followed and videoed people sitting. It's amazing. Not only will they sit in these types of positions, but they'll be there for hours and hours, day after day. Again, if your seat reclines backwards, the head now comes forward, which puts that same tension stress on the spine. So you can see these postures, talking on the phone, you can see how this could cause some postural effects. Just a few more of these. The slouching, the head forward, it's very, very common. Sometimes even sitting with the feet propped up, twisting our spine. These are actual workstations of people. Dentists, I treat a lot of dentists, a lot of hygienists, a lot of medical doctors, and you can see their posture. They don't really have much of an option. They have to get down in front of that patient. This is an actual workstation. A young man was in that position for actually a couple of hours. So you can see this is what's getting us sick. This is what's causing problems. So how do we fix it? How are we supposed to sit? And many of you have already seen these. You've probably had ergonomic studies done in your workplace. We all know that the computer should be at eye level. You want to be looking straight ahead, not with the head twisted to one side or the other, not looking down, not looking up. The shoulder, the ear over the shoulder over the hip. You want to maintain those proper curves of the spine. Okay, the elbows are at 90 degrees. She's not leaning toward the computer. Both feet are flat on the ground. Everything creates a nice 90-degree angle. This is how we are supposed to sit. Okay, so you've got this now, so you can refer to it as you need to, blow it up, give it to your children, whatever you need to do. But here's obviously the difference. So instead of slouching and rounding toward the computer, we should be sitting up straight like this. Keep that normal, see the normal lordosis, normal curves of the spine. That's what we want to do. Sitting up, some people use a tilted seat, and when the seat tilts forward, it creates a response so the body will come up. Some people use balls, the therapy balls, which is the same idea. We're trying to keep that curve in that spine. Okay, this is what we're trying to avoid, is leaning toward that desk. Now, again, we recommend changing positions. You can stand up, use the standing desk. If you're there in that position very long, you can sit down, change weight pressure from one side to the other. Now, texting. Here's another big problem that we have right now, especially with kids. Okay, there is actually a condition called text neck, and it comes because we are always looking down at our phone. And when you see how the spine is stretched forward instead of being up. So this is how we should be texting, sitting up straight, hands up where it should be instead of looking down. But this rarely happens. We're always in this position. It's just a natural thing to look down at our phone rather than bring our hands up. So this is something you need to be very, very careful, and this is why. They actually did research, and they actually found, if you look at this, the blue one here, this is in a normal posture. When your head is in a normal posture, the weight that's being compressed down on those cervical discs and the weight in that area at 0 degrees is 5.4 kilos. It's about 12 pounds. Okay, so the head is heavy. It's like a bowling ball. So if it's sitting in its normal position, there's 5.4 kilos of pressure. When you go to just 15 degrees, that goes from 5.4 to 12.2 and so forth. When you go to 30 degrees, it goes to 18 and so forth, all the way to 60 degrees, which is where we see most people. At 60 degrees, there's 27.2 kilos, okay? That's 60 pounds of force on those discs in the front. Now you can see why day after day after day of doing this, we are stretching our spinal ligaments, we're stretching the spinal cord, and we are causing our spine to degenerate. We're just compressing those discs. So it's very critical that we know to sit up, keep that ear over the shoulders and the shoulder over the hip. Because even if you bend at your hip, now the head has to look up. And so this is how the body compensates. So you want to make sure. So this is just to give you some information on actual objective evidence that shows what's going on in the spine. So Here again, we have a normal. This is a reverse curve. Instead of curving this way, this is the jaw. Palate is straight. But you can see as it forces forward, a reverse curve here, you can see how it compresses those discs. As a result, not only does the disc collapse, but now the body starts putting bone spurs, calcification in there to try to fuse and stabilize itself. So you can see the ones above and below. Some of those look fairly normal, but the ones right in the middle, they're holding all that weight. They are subluxated. They're diseased and they are going to collapse. This creates a lot of tension in the shoulders, the neck, sometimes numbness in your hands, headaches. Again, changing the oxygenation to the brain, which can affect all kinds of different organ function. So I put this on here just so that people can have an idea. This is just an illustration of the spine and all the different nerves and different blood vessels, arteries and so forth that come out. And the reason I point this out is because people come in all the time and say, well, what does that have to do with pain in my face or numbness around my eyes? And you can see how these nerves all come through all the face and all the head. If you are constantly putting stress on those nerves and on that area, you can have all kinds of circulatory problems. You can have nerve problems. These nerves control muscles. So people come in, they have, I've always had this reoccurring stress, this tension in my neck and shoulders, numbness in my hands. Here's why. This is the nerves and the blood. There's just so much that can get compromised when we don't have good posture. Again, some daily illustrations. This is what it looks like when we actually start texting. People standing around looking at their phones. Now you can start to see what it looks like and what it's doing to their neck. So when you see, if you have children, if your children are looking down all the time, or if you yourself are looking down at your phone for long extended periods of time, you're creating subluxations, you're creating disease. So when we talked about this in the beginning, the very first one we pointed this out, there's a big difference between health care versus sick care. Our goal is to try to help people get into health care and then stay there. Okay, sick care on the opposite is when we wait. So here's the definition again. Sick care means that you wait until you have a disease or a condition or a symptom like muscle spasm, tension, headaches, pain, digestive disorders, whatever they might be, numbness, tingling, even paralysis, blown discs. People wait until they have these severe conditions and then they go and seek care. It could be hospitals, meds, they could be getting a physio, they could be getting surgeries. All of those are for temporary relief. They do not correct the problem. They are in sick care. So the difference is health care is to prevent that. Now most of the time people come in, they have some type of condition, so we want to help them get correction and get them into health care, and then once they're in health care, we now want to avoid or prevent these diseases. And these are lifelong strategies. It's something you have to focus on, and exercise, rest, nutrition, the habits that we're talking about, and that's why we're doing this. So we're trying to get everybody into health care. So please don't wait until you have symptoms. Many times people will say, I don't have any problems, therefore I haven't had my spine checked. I'm trying to say that's the point. You want to stay in health care, so get it checked. You don't have to have it checked as often as somebody who is having a condition. So prevention, you've heard this before, an ounce of prevention is worth a pound of cure, which is so true. Not just financially, it's much cheaper to take care of your health than it is to wait until you have some heroic surgery or some invasive medication or procedure to try to correct something. And sometimes it's just like a fire. The longer a fire burns, the more damage is done, and sometimes you can't replace it or repair it. So it's really about prevention. Stay in the healthcare. So how do we do that? Just like this. Today's topic has to do with our posture, the way we stand. We want to stand again with our ears, shoulders, hips all in a line. When we sit, we do the same thing. The spine stays in that same position whether you're standing or sitting. This is the first step, okay? Or one step, I should say. But in order to be healthy, we have to make sure we get rid of subluxations, because poor posture, sitting, bending, twisting, all the things that we do, our sleep postures, which we'll be talking about in our next workshop, causes nerve interference. Okay, so we have to have these subluxations removed. Now it's critical. There's only one way to remove these subluxations, and that is with chiropractic adjustments. okay? At any age, infants, elderly, anybody. And so chiropractic adjustment, this is not physio, this is not medication, surgeries, and exercise. Those are all supplements. So the goal is, if you don't get those spinal joints independently moving, then they're going to degenerate, and they're going to cause oxygenation problems to the brain. They're going to cause all kinds of health conditions. So this is how we do this. We do spinal adjustments. We teach people about their posture. Last time in our last series, we just showed about nutrition. It's critical that we eat correctly. These are all steps for us to have optimal health. So why doesn't just one subluxation work for the rest of your life? It has to do with what we call neuroplasticity. Neuroplasticity basically is this: the more time we can get your spinal joints to stay in an unsubluxated, in other words, they're not fixed, they're not misaligned, the more we can keep them moving and functioning, the more the nervous system learns to keep it there. It's just like learning any other skill, writing your name, shooting a basketball, anything you do, playing a piano. The more you practice, the better you get, because those nerve pathways learn. That's called neuroplasticity. And the same is true with your spine. The more we can keep it functioning the way it should, the better it is at keeping it there. So it's essential that you get your spine of your entire family, anybody that you know, they need to be checked. They need to have these subluxations adjusted frequently and consistently. I highlight those because you can't just get it done once every 6 months. You need to consistently have treatment in order to keep those going. Just like your exercise or like brushing your teeth, it's a lifelong process. But the good news is, the more you do that, the better the quality of your life is going to be. And I put this little continuum on here, and I'm going to talk more about this in our future. But basically, from the time we are born and we go through life, we have an episode when we're young, we're vibrant, we're healthy. And then gradually, due to our posture, due to our poor diets, due to our sleep habits, all of these things we're talking about, we start going into this sick or unhealthy disease condition. And we are going to continue to go down that ramp and down until we end up with serious health problems or death. The only option we have is we have to make lifestyle conscious choices to change that. The sooner you change it, the less treatment you need. And so our goal is people are coming down this slope. When we are down here, it requires a lot more treatment, a lot more correction to get the body healing again, and that's what this has to do. So we regain our health. And when we get up to this position right here, some people will continue, and they may go for the rest of their life every 1 or 2 weeks without pain. Again, we're in healthcare, getting these frequent treatments to maintain their health, and their health just continues to get better and better and better. Now, some people, they'll kind of taper off after they've gone through their symptomatic stage. They feel like they're doing quite well. They just want to maintain right where they are. They'll continue getting their spine checked and adjusted every 2 to 4 weeks. Okay? You can keep it fairly, after you've gone through correction, keep it fairly maintained. You're not really going to go up, but you're slowing the decrease. Some people will take a break. They say, okay, I think I've had enough, or I can't continue. They start missing. And so what happens is we're not focusing again on our spine. Even if some of them have pain and they think it's not working, it just takes time to heal. You have to understand it takes a long, long time. And the longer it's been there, the longer it's going to take. But the point is, we have to keep it from getting worse, and over time the body will heal, just like healing a broken bone, healing a burn, or any other type of wound. Sometimes it takes a while for those to heal, but the point is, some people will stop. And so what happens is we see them go all the way back down. Their health drops off, and then they come back in 6 months later or a year later, say, oh doc, my back is out again, I've got these headaches all over again. So we start them all over again right here, and then we have to go through this whole cycle again. So I'm just trying to point out that this is a lifelong process that you need to be aware of, just like any other health process that you do, exercise or brushing your teeth. Health for life is quality for life. And again, I'll close with my favorite pictures. Okay, I love this picture. Both these women are 80 years old, as you heard me say before. The difference between them is their lifestyle choice. You can tell which of these have been focusing on their diet, they've been focusing on their exercise, they've been focusing on their posture. And you can tell even just as they stand how much healthier they are, because their body's not breaking down and degenerating. So you get to choose. You can choose A, sick care, wait until a condition happens, and then try to go to the hospital and have some heroic repair or treatment, which sometimes can't be replaced. And so we end up in wheelchairs and debilitated. Or you can choose the health care and try to choose to prevent those. So please tune in next week. If you haven't seen the first two, this is now the third. If you haven't seen the first two episodes, please go back and watch those. Next week we're going to be talking on it's our fourth one. We'll be talking about how important sleep and rest are to our health, how to choose your right pillow, what's the best sleeping posture, how to choose your mattress, why it's so critical that you have good rest, and how that affects your health. So if you have any questions, now we have had several people ask us about pillows, about different types of exercises, different types of stretches. So I'm really happy that we're getting those responses, and I'm going to postpone those because the very next two workshops are talking about that. The next one is going to be on sleeping. The one after that is going to be on stretching and exercise. So please send these to as many friends as you can. If you've been a patient in the past, we welcome you back anytime. Please, let's keep you in that health care. If you've never been to a chiropractor before, you're welcome. Come in, we'll do an assessment and make sure everybody's okay. Until then, I just want to wish everybody good health, and please take care.